Hey guys, a beautiful morning, beautiful afternoon, and beautiful evening to every one of you, my fellow nurses. How are we all doing? I know we are all doing well. How is preparation for our OSCE exam? Guys, I really don't want you to be anxious. OSCE is very simple and nurses are equal to the task, all right? So make sure you practice it with your friends, practice with your pillows, and make sure you're not getting it, and make sure you're getting it right, all right? If you're not getting it right, please call for help, all right, guys? So, guys, today I'll be teaching you implementation, because a lot of people have been asking me, can you talk about implementation in the new test of competency? So I'll be talking about that today. I hope you understand it. All right, guys. So if you're meeting me for the first time, my name is Violet Okolocha. I talk about everything you need to know about OSCE and nursing here in the UK. All right, if this is what you want, watch to the end. All right, massive congratulations to those of you who have passed your OSCE exam. I got 10 messages yesterday. I'm super proud of you all, and more than the sky is your limit. So let's get started on implementation in the new test of competency. Now, what you need to know is, you see the patient's surname. So when you get to your implementation station, they tell you the time of medication you'll be giving. So let me just write here, we'll be giving 12 o'clock medication. So you get the patient's name. The patient's name is what? Porter. The patient full name is Hash. You get the patient date of birth. You get the patient hospital or NHS number. You get the patient's height, the patient's weight, the body surface area. You get the date of admission. You get the time of admission. You get the number of prescription record. You get all prescriber must complete this. So this is the prescriber. You get the patient's medicine the patient is allergic to, and you get the effect. Now I will calm down. What do they expect of you? Now they tell you are giving 12 o'clock medication. So when you get there, you introduce yourself to you do your hand hygiene first. After doing your hand hygiene, I'll do my hand hygiene. Hello, my name is Violet. I'm one of the nurses looking after you, and I'm here to give you your 12 o'clock medication. Are you happy for me to give you your medication? The patient tells you they are happy. All right. Can I confirm your full name and date of birth? You confirm their name, confirm their date of birth. Do you have any allergy? In this case, our patient is allergic to amoxicillin. The patient will tell you they're allergic to amoxicillin. What happens when you take amoxicillin? You have rash. All right. Don't worry. I'm not going to give you anything containing amoxicillin. Is that okay? All right. Lovely. The patient tells you it's okay. All right, then you say, okay, lovely, are you happy to have your 12 o'clock medication? The patient tells you they are happy. Do your hand hygiene, put on apron and put on glove. Then you can start from here now. So this is a medication chart for Hash Porter. The date of birth is 1st of 1st 1950, and the hospital number is 0004321. The patient's height is 1.57 in meters. The patient's weight is 74 kg, and the patient body surface area is 1.80. The patient is in surgical assessment units, and the consultant in charge of the patient is Dr. A. Richard. The date of admission is today, and the time of admission is 10 o'clock. All right, now you move forward. The patient is allergic to amoxicillin, and the reaction is rash. Now, if there is no allergy here, you say patient has no allergy. But in this case, the patient is allergic to amoxicillin, and the reaction is what? Is rash. Now, you flip through all the drug charts like this. I have the same name on all the drug charts, so I can confirm I have the right drug chart for the right patient. All right, so now we've read through this. I move over to the next charts. Now in the next chart, is it clear? In the next chart, I move over to the next chart. If you like, you can repeat reading the patient's name, but I wouldn't do. I move over to the next chart, and I still have the same patient, the same hospital number, the same date of birth. So I still have the right drug charts. Now, if you look at this very well, you see we have 10 code of medicine non-administration. Now, this are the 10 codes if you don't administer any medication to the patients. The only code that is relevant to you, all codes are relevant, don't get me wrong. The first code here means medicine unavailable. The second code means patient is off the ward, but you can never get patient off the ward because they want you to actually perform the ski. The third code is self-administration. The fourth code is unable to administer. But the only code I would advise you to use in your OSCE exam is code of 10. A lot of people have been asking, Vale, what code do you give? Use code of what? Of 10. So I still have the same drug chart, the same patient name and the same patient information. So I still have the right drug chart. So I move over. So once only medication. I move over to what? Once only medication. Now, for once only medication, this patient does not have any once only medication. Now, on your exam day, you may have a patient that have once only medication prescribed. If they have once only medication prescribed, read it out. And if it has been given, also read it out and ask the patient, can you confirm you had this? Okay, let's assume on the once only and start those medication, we have dates today. And we have paracetamol. And we have dose 1 gram. We have root PO. We have time. Let's say we have time 11 o'clock. We have prescriber signature and blip number 1, 2, 3, 4. Time given 11 o'clock signature. So now I move over to once only medicine. And I have here dates today. Drug is paracetamol. The dose is 1 gram. The root is PO. The time is 11 o'clock. Prescriber signature is here. Prescriber blip number is there. This drug has been given at 11 o'clock. I'm sorry, Mrs. Hash Porter. Can you confirm you had paracetamol given to you at 11 o'clock? Is that correct? Can you answer?
Yes.
Oh, perfect, perfect. So the next thing you want to do, you want to move over to what? To the next charts. So sorry, guys. I move over now to the next charts. Now, I still have the same patient's name on all the drug chart. Let me take this out. Sorry, guys. This might delay the video, but... Okay, so I move over to the next chart. And on the next chart, I still have the same patient's name. If you like, you can say I still have Ash Porter, date of birth 1st of 1st, 1950, hospital number 0. Or you can say I still have the same patient's name on the next chart. So I have the right drug chart for the right patient. And I move over to prescribe oxygen. Now, in your OSCE exam, you are not allowed to administer oxygen. So now, this patient has no prescribed oxygen. Now, in your OSCE exam, you might have a patient that has prescribed oxygen, and then you will see the dates here, you will see the time here, you will see the flow rates. So if you have a patient that has prescribed oxygen, all you need to say is, I move over to prescribe oxygen. This patient has oxygen prescribed. So, Mrs. Porter, can you confirm to me you are currently having oxygen?
Yes.
Oh, you're currently having oxygen. That's fine. At the end of this, my implementation, I'm going to take your oxygen saturation level, okay? And if we have met the target oxygen saturation level, I will come over and ask the doctors if the doctors are happy for me to take off your oxygen. Is that okay?
All right.
Lovely. Now, in this case, so you don't do anything. Even if the patient has oxygen prescribed, you don't do anything. The only thing you do, you just want, maybe you see the dates, you see the time, you see the flow rate, you see the prescriber signature, you see the prescriber print name, you just verbalize. Mrs. Ash Porter, are you having oxygen? Because I see here you are having oxygen. Because you've seen the prescription of the oxygen. The patient will tell you yes. The next thing you need to do is just to tell the patient, all right, after my implementation, I'll check your saturation level. If you have met the saturation level, I will ask the doctors if they are happy for me to take off your oxygen. That's all. Now, what if the patient has no oxygen prescribed? Like in this case, our patient has no oxygen prescribed. The only thing you want to say is, I move over to prescribed oxygen, and under prescribed oxygen, patient has no prescribed oxygen. And I move over to the next chart. Now, the next chart is what? Is page 25. And in page 25, I move over to the next chart. I have Ash Porter, date of birth 1st of 1st, 1950, hospital number 0004321. You see, or you can say I move over to the next chart and I still have the same drug chart for the same patient. So I still have the right drug chart for the right patient. So I move over to the next chart. I have Ash Porter, date of birth 1st of 1st, 1950, hospital number 004321. And I move over to antimicrobials. I have here drug amoxicillin. The date is today. The dose is 500 milligram. The frequency is QD. The route is PO. The duration is 7 days. The start date is today. The finish date is 7 days. The prescriber signature and blip is here. Dr. P writes and the blip is 642. This drug is due at 12 o'clock. Are we giving amoxicillin? We are not giving amoxicillin. Why are we not giving amoxicillin? We are not giving amoxicillin because our patient is allergic to what? Amoxicillin. Now, because our patient is allergic to amoxicillin, can we give amoxicillin? No, we can't give amoxicillin. So what do? We write a code of what? We write a code of what? A code of 10. So any medication you are not giving, probably because of any reason, maybe the patient is allergic to wheat or the patient has low blood pressure, you give a code of what? Of 10. Now, you are not signing. You are giving a code of 10 because you are not giving the what? You are not giving the medication. Now, what will you now do after giving a code of 10? Once you put a code of 10 here, turn to the last page of your medication charts and you are going to see omitted dose of medicine coded 10. Order and delayed doses. You come here, you write the date. What is the date they give you? What is the date they gave us? Today. You write the date today. And what is the drug? The drug is amoxicillin. You write the drug amoxicillin. What is the dose? The dose is 500 milligram. You write the dose 500 milligram. What is the route? The route is PO. Forget about instruction. Then what is the time? The time to give this drug is what? The time to give the drug is what? Is 12 o'clock. You write time given 12 o'clock. Reason for omission. Our reason is 10. Why are we using 10? The reason of is what? Is 10. You write 10. Then you bracket open and close. Patient is allergic. And you put your what? You put your signature. My own signature is what? Is VO. I put my signature. So immediately you are coding any medication, please go to the back and write omitted dose. Now, if you only code this medication 10 and you don't come to the back of omitted doses of medicine, you are going to be failing your OSCE exam. That's not your portion. So immediately you are writing 10 where you are supposed to sign. You come to the back, write the date, write the drug, write the dose, write the route is PO, write the time given. The time given is 12 o'clock. Because that's the time you are supposed to give, write the reason. And for the new ones, if you are not giving a medication, the best reason to put is 10. And I wrote bracket open and close. Patient is allergic, and I put my signature. This is a what? This is a pass. Now, I move over to the next drug. There are no more prescribed antimicrobial. There are no more prescribed what? Sorry, darling. There are no more prescribed antimicrobial. So, you move over. Now, sorry guys, I have to go to page 26. So now I move over to what? To page 26. I'll put a plaster so that it can stick because I think my hands is paining me now. I'll put a plaster so that it can stick. Okay. So guys, it didn't work anyway, so I don't want to delay much of your time. So I move over to the next chart. I still have the same drug chart for the right patient. Or I move over to the next chart. I still have the name, surname, Porter, forename, age, date of birth, 1st of 1st, 1950, hospital number 0004321. And I move over to regular medicine. Regular medicine. And the drug I have here is Ramipri. The date is today. The dose is 5 milligram. The frequency is OD. The route is PO. The duration is 7 days. The start date is today. The finish date is in 6 days. Prescriber signature is here. The blip number is here. Is this drug due at our time? This drug is not due at our time. So you don't even have to read a drug not due at your time. Once you look at it, you say it is not due at your time. I move over to the next drug. Is this drug due at our time? It's due at our time. The next drug is Tab by Soprolol. The date is today. The dose is 10 milligram. The frequency is TDS. The route is PO. The duration is 7 days. The start date is today. The finish date is in 7 days. Prescriber signature is Dr. P. Wright and his blip number is 642. This medication is due at my time. Don't forget we are giving what? We are giving 12 o'clock medication. So this medication is due at my time and I'm happy to what? To administer. Now, before you administer this medication, it is important for you to know the patient's heart rates. All right? So what our advice is before you even venture, look at the drug and say this drug is valid at my time. Sorry, Mrs. Hash Porter, can you confirm to me what's your heart rate? And if the patient tells you their heart rate is below 60, you know you are going to code this medication. If the heart rate is below 60, you can't give what? Bisoprolol. The normal heart rate is 60 to what? To 90. So if the heart rate is below 60, you can't give what? Bisoprolol. So it is important for you to know a patient's heart rate and know a patient's blood pressure before dispensing a medication. Why did I say so? I had a student who went for OSCE exam and she said to me, say Nurse Violet, after I had dispensed Ramipri, I've confirmed it. I said, this is Ramipri. It is valid. The expiry date is 2022. I'm happy to administer this medication. After I pop it in the pod, the patient told me their blood pressure is 80/50. So don't bother dispensing the medication if you have not confirmed the heart rate so that you know if you are dispensing. So now, Mrs. Haley, can you tell me your heart rate? 60. Your heart rate is 60. Perfect. Oh, your heart rate is 60. I'm happy to dispense this medication. Now, this is Tab by Soprolol. the expiry date is plus 3 days. So plus 3 days means the drug is expiring in 3 days time. Or the expiring date is 15th of March 2022. So this drug is valid. I'm happy to dispense. Then you can dispense your medication. Now, after dispensing the medication, put a dot here. Why did I say put a dot here after you finish dispensing your medication? I've had a lot of students who, during the time they were giving the medication, their time is almost up. And because they didn't put a dot, they ended up signing in the wrong place. Once you finish dispensing your medication, you finish putting your medication in the pot, put a dot here. So immediately you are finished giving the patient medication, your assessor is saying 1 second, just go to where you put a dot and sign. I hope we understand it. If you don't understand it, feel free to ask some questions. Now I move over to the next drug. This drug is not due at my time. So now I'm moving over to the next chart. Sorry guys, 26. After 26, I'm supposed to be given 27. So I move over to the next chart. So now on the next chart, I have the same patient, Porter Ash, date of birth 1st of 1st 1950, hospital number 0004321. And the next drug is what? As required medicine. Now, when you come to as required medicine, we call them PRA medication or as required medicine, guys. If you are not giving these medications, you don't need to code them. PROM medication are not to be coded if you are not giving them. As required medication means at the nurse's discretion if it is required. So a lot of people are like, Nurse Violet, if you are not giving PRM medication, do you need to code them? You don't need to code as required medication or PRM medication if you are not giving them. So I move over to as required medication. Mrs. Hash Porter, are you having any pain at the moment?
No.
Okay. Now, the patient is not having any pain. You don't need to give this medication. So because it's as required medication and you are not giving, then you don't need to code it. All right? So you don't code as required medicine. Whether you are giving or not, you don't code it. It's only if you are giving, you just pop the time. Now, Mrs. Haley, are you having any pains?
No.
Can you score your pain for me? Just say you're having pain. Are you having any pain?
Yes, I'm having
Can you
pain.
score your pain for me? 0 being the least and 10 being the highest.
5.
It's probably a 5. All right. Now, before you give as required medicine, make sure you check once only and start dose. Oh, so you're having a pain score of 5. Did you say you're having a pain score of 5?
Yes.
Oh, bless you. You're having a pain score of 5. All right. Because you're having a pain score of 5, I'm going to be giving you your pain medication. All right.
Okay.
Now, before I give this pain medication, go to once only medicine. I go to once only medicine. What happened there? Once only medicine, they've given paracetamol at 11 o'clock. Is it clear? Can you see paracetamol given at 11 o'clock? Now, can I give paracetamol at 12 o'clock? No. Oh, Mrs. Porter, because you had paracetamol given to you at 11 o'clock this morning, you told me you had paracetamol given at 11 o'clock. Did you say so?
Yes, I did.
And now it's 12 o'clock. Although you are still having pain, I'm not happy to give you paracetamol because paracetamol is to be given 4 hourly. And you do not have any further PRN medication prescribed. So what I will do, I will escalate with the doctors and see if they can give you any other PRN medications, okay?
Okay.
So you don't give. Don't just assume, oh, the patient is having pain. No, if the patient is having pain, look at your once only and start dose and look at your regular medication. Probably the patient might have paracetamol, like in this case. All right? So if you are not giving PRN medication or as required medication, you don't need to what? You don't need to code it. So, and finally, I move over to page 28. So, I move over to the next drug chart. And on the next drug chart, I have here surname Ash Porter. I have here surname Porter. I have forename Ash. Date of birth 1st of 1st 1950. Hospital number 000432. And I have here infusion. In your OSCE exam, you are not allowed to give infusion. So, patient has no prescribed infusion. And I move over to the next drug chart, omitted doses. So this is about amoxicillin, which we omitted. So guys, I hope you understand it. Before giving any as required medication, make sure you check your once only and start dose that the medication has not been given, okay? Now, if I have just rushed and gave the patient PRON or as required paracetamol just because the patient is having pain without looking at my once only and start dose, I would have failed. Because when I looked at my once only, I saw that they've given the patient paracetamol at 11 o'clock and I'm giving the medication at 12. So guys, it is very important. Before giving any as required medication, check the regular medication and check the PRN medication. And before giving any medication at all, check your allergy. All right, I wish you all success in your OSCE exam. If you have any question, feel free to pop it up. I will see you in my next video, and until I see you again, keep passing your OSCE exam. I love you all guys, and bye.